Next speaker is Dr. Valeriya MANTSOVA. Please.
Hello. My name is Alexandra Proshka, and I'm a co-author of this work. Unfortunately, Valeriya MANTSOVA isn't here today, so I will be the presenting author. Thank you. And I want to present our research work about cataract extraction in patients with keratoprosthesis. Nowadays, it is widely known that cataract is a common condition accompanied by corneal glaucoma in patients who underwent keratoprosthesis, and for patients who is going to undergo this operation. So the objective of our work is to evaluate the differentiated approach to surgical treatment of patients with vascular glaucoma and cataract. And this approach, this surgical treatment includes cataract extraction at various stages of keratoprosthesis implantation. To make it a little bit clear, in Russia, we perform keratoprosthesis implantation in two stages. The first stage involves intralameral plate implantation, and the second stage involves optical cylinder implantation. So our surgical approach is going to be different because of different corneal glaucoma thickness. If it is less than 500 micrometers, then we perform corneal prosthetic complex transplantation simultaneously with cataract extraction. And if it is more than 500 micrometers, then we perform cataract extraction during the second stage or in the long-term postoperative period. And there are some complicated cases when we perform intracapsular or extracapsular extraction during different stages of keratoprosthesis implantation. So our study enrolled 30 patients, 30 eyes, who underwent these manipulations, and we divided them into three groups. The first group included eyes of patients who underwent cataract extraction simultaneously with corneal prosthetic complex transplantation. The second group involved eyes of the patients who underwent cataract extraction during the second stage, and the third group included eyes of patients who underwent cataract extraction in the long-term postoperative period after keratoprosthesis implantation, and it was made by doing fecal emulsification or intracapsular extraction. During pre-operational diagnostics, we paid attention to the corneal thickness and to the extent of lens ligamentous failure. So in group 1, we performed so-called open sky cataract extraction. And after that, we transplanted corneal prosthetic complex. And it is important that we didn't implant any intraocular lens because there are a lot of risks for postoperative complications in this case. And we just implanted aphakic optical cylinder as the second stage. In the group 2, we performed cataract extraction during the second stage of the keratoprosthesis before implanting the optical cylinder. It is also extracapsular, but the difficulty is that we have limited visualization, and sometimes lens masses are not totally removed. So there were some patients that we needed to who needed to undergo the second operation in the early postoperative period, but it didn't affect the outcomes. And the visual acuity was really high. And the third group, there were 4 patients who underwent intracapsular cataract extraction, but it was really traumatic because of the big cut. And only one case when we performed a fake emulsification, but it was really dangerous, and we decided not to do it again because of the high risks of intraoperative complications, and we don't recommend it to perform, to be honest. So there were some complications in each group, in intraoperative and postoperative complications. And here you can see the results of our research. If we compare it with pre-operative ones, the visual acuity increased significantly in each group. So in conclusion, I would like to say that cataract extraction in patients with keratoprosthesis is really technical, difficult operation. And of course, the surgeon needs high surgical skills for doing it, but we hope that our research and outcomes will help to deal with this problem successfully for all of us. Thank you.
Thank you very much.